Let me very briefly introduce my colleagues, and I think they will be very interesting people to you. To my right is James Schwartz, who is Fire Chief of Arlington County, Virginia. He has been a career fire officer who has been active nationally in many advisory committees. And perhaps the peak experience of his life was that he was the commander of all the emergency response forces at the Pentagon on September 11th, 2001, and during the following 2 weeks when the fires at the Pentagon were being put out and when simultaneously the site was a disaster site, a crime scene, and the continuing to operate as the National Military Command Headquarters of the United States. To Jim's right is Professor Lan Shui from Tsinghua University in Beijing, China. Professor Shui is has recently stepped down as the Executive Vice Dean of the School of Public Policy and Management at Tsinghua University, which he helped to found, an institution that is has parallel functions to the Harvard Kennedy School. In addition, Professor Shui is one of China's foremost specialists in emergency management and crisis response. He has consulted widely to the national government in situations like SARS and in planning for possible emergencies that might stem from the Olympics. He was educated in the United States at Carnegie Mellon, where he received his PhD, and spent time as a faculty member at George Washington University. So we're extremely pleased to have both Jim and Lan with us today. I'd like to start out by setting some general context for the situation that we're dealing with here. In the brief history of the 21st century, we've experienced a number of searing events that have focused attention on society's capacity to respond to emergencies. And these events I think, can be thought of in several different categories, and we certainly have examples of these from around the world. The first are natural catastrophes, exemplified perhaps by the Pakistan earthquake and the Asian tsunami in 2004, by Hurricane Katrina in the United States in 2005, and the paralyzing snowstorms that struck China just this past January in 2008. A second category that we could think about that is very different but has many of the same implications for society are outbreaks of new and threatening diseases like SARS, severe acute respiratory syndrome in 2003, the perceived threat of avian influenza, and more generally, the predicted appearance of some form of pandemic flu that the world has seen a number of other times as well. A third category that we could think about are technology failures and industrial accidents. The United States experiences mine cave-ins, as does China. There are major transportation disasters, such as the foundering of an Egyptian ferry in stormy seas that took the lives of more than 1,000 people in 2006. Major catastrophes like the disintegration of the Space Shuttle Columbia. And finally, a fourth category, intentionally created disasters, terrorist attacks, such as the fateful 9/11 assaults on the World Trade Towers and the Pentagon in the United States, the anthrax-laced letters that followed only a month or so after that, the train bombings in Madrid in 2004, the London subway and bus bombings in 2005, and many other incidents of terrorism around the world. But we might ask why these things are so important to government policymakers and managers. Disasters like these, some of them even more dire than the ones I've just mentioned, have always plagued human society. But I think we could argue that the scale and density and interconnectedness of modern life magnify the impact of present-day catastrophes. For one thing, transportation systems mean that some potential emergencies, most notably emergent infectious disease or terrorism, can travel very rapidly from one country to another or even around the world. interconnectedness of various sorts has also increased the visibility and the potential political impact of modern disasters. The near omnipresence of contemporary communications media means that we learn faster and in greater detail about most disasters. Video and photographs are quickly flashed around the world, even from remote areas, and the immediacy and the visual impact of human tragedy seen on television or on the internet enhances the emotional effects of these disasters and makes us all feel that we are in some sense participants in these events. It's also true that the effectiveness of response to natural disasters or other kinds of catastrophes is very visible too. In some cases, resourcefulness, heroism, and resilience are prominent features of that aftermath. But in others, the visibility highlights lack of preparedness, poor communications among emergency responders, and very weak coordination, and thus expands and increases the pain that catastrophe imposes on society. In the face of disasters, elected leaders must increasingly explain why serious emergencies that might realistically have been prevented have instead occurred on their watch, and why their jurisdictions failed to respond effectively to those emergencies, even when those emergencies occurred from no fault of the elected leaders themselves. And political rivals of these leaders are going to try to hold them accountable, both for failures of prevention and for how well response and recovery efforts were conducted. Disasters of this sort have very extensive impacts on society. Obviously, those immediately in the path of a major emergency are severely affected, but others linked by family or social ties or by connections to disrupted economic networks also experience the disaster in many different ways. In China, just a couple of months ago with the blizzards, the immediate impact affected many areas in the country, but it also had secondary effects in terms of slowing or interfering with movement of coal and other fuels on the rail system. It interfered with the transport of food to areas that had no snowstorms, and an indirect effect also was to make this a political issue in the country. Beyond these kinds of immediate effects, society pays high monetary costs through public budgets and charitable and personal resources in reconstructing damaged physical infrastructure, struggling to restore community vitality, and rehabilitating lives that are disrupted by the various kinds of emergencies that I've been talking about. And so with increased realization that such disasters are truly linked in terms of their societal consequences, comes a recognition that greater personal, organizational, national, and international efforts are required to prepare for future catastrophes so that we can handle them better and minimize or mitigate the experiences that society has with these. I think it's important for those of us, for all of us here who are very interested in issues of public management and innovation, to think about the fact that emergency response is a very distinctive kind of emergency problem, of public management problem that differs in very important respects from the kinds of things that we're most used to. For example, emergency management is not a matter of administering routine operations or service delivery, where the key problem could be thought of as matching the supply of service in time and space to a more or less continuous, though sometimes varying flow of demand from citizens or organizations for that particular service. Emergency management also isn't like project management, where a unique capital facility or perhaps operational activity is conceived, planned, and executed on a schedule. Nor is it like the familiar overhead functions of government, like budgeting, human resources, planning, or policy development, which are undertaken on behalf of senior executives or legislative overseers as a way of supporting or analyzing or critiquing operations. By contrast with these more ordinary kinds of activities, emergency management demands very different capabilities. It requires readiness, as near to instantaneous as possible, for a wide range of contingencies that happen only episodically or perhaps not at all in a particular place. It means that responders have to prepare for events whose precise nature, the timing of them, the type of event, their location, the specific requisites for response that are needed. These characteristics can only be loosely predicted, and prior training, experience, and drill may not have been appropriate or adequate for the kind of emergency that is actually going to be faced by a real place at a real time for the personnel who were there. Ideally, all of the individuals and professions, the effort that is required by emergency conditions will certainly involve those who think of themselves as emergency responders. And we have specialized functions in government and in civil society that specialize in this area. Firefighters, law enforcement, emergency medical personnel are the most commonly thought of. But under severe circumstances, it's also likely to involve others whose normal activities and professional identities don't center on disaster management. These may include people like public health officials, transportation officials, public works employees, social service professionals, education people, as well as a wide variety of private sector entities that may be called into service or be deeply affected by emergencies. In our panel today, we are going to have several focuses. One way that we could think about this problem of emergency management is to look at several dimensions of the problem. And the most common way of thinking about this is to talk about prevention, mitigation, response, and recovery from emergencies. Had he been here today, Mihir Bhatt, who unfortunately was forced to remain in India because of family illness, would have focused on mitigation and response by reporting on a campaign in India to prepare schools for the impacts of natural disasters, for example, earthquakes or cyclones. This effort that he was going to describe is in the abstracts that you have in your program book, and I strongly recommend that you look at it to see about the effort to promote adoption and implementation of safety practices in schools, which began in Gujarat in India and has spread to other jurisdictions. We do today have with us, however, Lan Shui, whom I mentioned before, one of China's leading experts on crisis management, and he's going to report on innovations in Nanning, the capital city of the Guangxi Autonomous Region of southern China, to integrate telecommunications capabilities for citizens to report emergencies and get appropriate response quickly to the scene. By thinking in an all-hazards way rather than by particular types of emergencies, this system in Nanning has reduced the burden on citizens to know the correct way to report different kinds of emergencies and to mobilize different kinds of responders. And as a result, it's greatly improved the speed and effectiveness of their operations. Professor Shui will also talk more generally about some of the circumstances in China today that affect the emergency management system. And finally, Jim Schwartz, Fire Chief of Arlington County, Virginia, is going to describe how in a major catastrophe like the Pentagon experience, the Incident Command System or Incident Management System, often referred to as ICS or IMS, enables diverse groups of responders to integrate and operationally coordinate their activities. And he is going to, in addition, speak about some of the conditions that are affecting the U.S.'s national effort to create a national incident management system for all responders in the country. So without further ado, let me turn the conversation over to Professor Lan Shui.
Thank you, Arnold. Arnold has set up a sort of very nice context for what the issues at hand. Now I'd like to turn that into China's context. As all of you know that China over the last 30 years have gone through some major transformations, including one that's the economic system is changing from a planned economy to one that's based on the market system. And the second transition is on making the societal transition from one that is mostly a rural and closed society to one that is increasingly urban and open society. And the third transition is on the governance system. It's also making major transformations from one that's based on individual will and the charisma to one that's increasingly based on broad participation and the rule of law. Those transitions have happened in many countries over the development process. But I think if you look at in China's case, all of these transitions are happening at the same time over a relatively short period of time, if you look at it from the historical point of view, of 30 years. And the country was 1.3 billion people. So this transition, I think, if you look at it from this perspective, it's unprecedented in the human history. So indeed, while China has achieved some major progress in economic and some other areas, but also I think these transitions have also generated tremendous tensions and fault lines and problems and so on. And so including, I think, ones that, how to deal with different kind of natural disasters and, pandemic problems and industrial accidents and so on. That's already been discussed by Arnold. And particularly, I think, as we've all seen that in SARS, during the SARS in 2003, there was indeed, I think, really showed the weaknesses of Chinese response emergency management system. So actually, after 2003, the Chinese government has made major efforts in trying to improve the national emergency management systems, including passed a new law on emergency management, drafted a national emergency plan, and also actually that has also permeated to many specific areas and different agencies, and also has established the emergency management systems within throughout the government agencies. But I think that systems are really responding to the major disasters, the major situations. That's what Arnold just outlined. But there are also daily emergencies, problems that actually the citizen would just call, whatever the numbers that's being used in a particular city or country. And so here what I'm talking about, the innovation I'm going to introduce is a case study that we did several years ago in Nanning City of how they established a system that actually respond more efficiently to this sort of daily crisis and daily emergencies of the general public. The problem that's faced by the Nanning City is that as China develops, Nanning City has also, I think, developed very fast, and the population expanded, the economic activities have grown many times, and then the problems that the emergencies also have increased. And previously, as in many other cities in China, that there are different separate phone numbers for different kind of emergencies. For example, 110 for police, 119 for firemen, 120 for media ambulance, and 122 for traffic accidents, and so on. But what happened is that, first of all, many people do not necessarily remember all these numbers, and sometimes they dial wrong. And that you get to a slowed and wrong response. And so what Nanning was trying to do is that when they were trying to expand the capacity of the system, they're trying to integrate all these four into one. So whatever number you dial, that you can really just reach to the emergency management response center, and that can dispatch whatever is necessary to respond. And so technically, that's possible. So actually, they adopted a new system that can do that, and actually that indeed actually now is being successfully implemented. But what actually our case study also found that in a way this is a sort of technical innovation, adopting something new, but there are also actually many organizational obstacles and problems that you have to address before such a system can be well used. So I just say a few words on that. One is that the problem is, of course, is technical problem that the system has to be you have to run in and to solve all the problem that so that it can run smoothly. And the second problem is more of organizational problem. The emergency response center, which integrates all these numbers, it also actually has to integrate the relevant agencies that the agency send people to this emergency center. So they will, once they get the call and to respond to send the message to the whatever the agency they have. But of course, these people, they are at this particular response center. Their status is not very clear because, say, in a way, they are, for example, you are from the fire department, but now you are sitting at a different location in this emergency center. So your, personnel management and and so on, those create sort of problems and anxieties for the employees. And secondly, is how do you overcome the barriers of different agencies of not willing to share their limited resources? And because once you get things together, I mean, sometimes it's not so clear for one particular emergency whether you should send one or two or different agencies to respond or at the same time. So I think that's also a problem that they run into. And the third is more of a central and local government relations. And here that many of these emergency numbers actually used nationwide. And so in a way, this was, for many years, was already determined by the central government agencies that's used nationwide. And by combining all this together in a way that there's certainly, I think, a possibility that someday one of the agencies, one of the functions that may be actually absorbed by this, comprehensive emergency response center. So that's actually one of the central government ministry people person who visited the center. While he liked the system, but he also said, aren't you guys are going to eliminate, our agencies someday? And so that showed, so the uneasiness of, that problem. So I think that central and local relationship is also shown up here. And finally, of course, is how to change public's behavior. There is actually a discussion about whether it's possible just to integrate those numbers into one, so that people can just use that one number. But of course, that people are still, I think, whatever the number they remember, they like to use it. So they were trying to use one, but certainly it's not possible. So currently, they still have whatever the four numbers you have, and then whatever the number you dial, and certainly will integrate it to the place. So I think that's the problem that they run into, and they've tried very hard and to solve this problem. And now the system has been used very smoothly. And now actually the response rate is much faster, actually 4 or 5 times faster than before, and also capacity also has increased tremendously. So the system has played a major role in safeguarding the daily safety of the general public, and also in dealing with those emergencies. So it actually has become a model to be followed by many Chinese cities, including Shanghai, Guangzhou, and Shenzhen, and Wuhan, and so on. There are many much larger and major cities that actually now have to come to Nanning and to learn from their experience in how they can respond. They can establish the system to better respond to the need of the general public. Let me stop here. Thank you.
Thank you very much. Public managers are certainly familiar with the problem of coordination of their activities with those of others. It's a pervasive problem that any kind of government agency faces. In emergency management field, though, this coordination problem presents itself in a fairly unique way because in a major disaster, many different agencies, professional groups, representing not just one jurisdiction often, but many jurisdictions, even many states, different levels of government, will all show up at the same place at the same time, often under conditions of considerable danger, if it's an ongoing crisis, or at least of danger to the people who are affected by it. And they need to operate as close to seamlessly as possible dealing with this danger. They have to divide up the tasks that are presented to them. They have to carry those tasks out effectively. And they have to do all of that without stepping on each other's toes or even endangering the lives of the people who are involved as responders or as people affected by the disaster. this issue of coordination over the last 35 years has been confronted in the United States by the development of a system called incident command or incident management. And it's this subject that Jim Schwartz is going to speak about.
Good. Thank you, Arn, very much. And thank you all for the opportunity to be here today. In Arn's earlier comments, I was struck by his description of my experiences at 9/11 as being a defining moment in my life, because I tend to actually think that the daily challenges presented by my teenage children are really more the defining moments of my life. But nonetheless, to the extent that that experience did affect me, and the work that we did leading up to that and the work that we've done subsequently, hopefully I will be able to share a little bit of those experiences with you all today. Let me first make a general observation about what we are going through in this country right now as the result of the experience of 9/11. And that is that through things like NIMS, or the National Incident Management System, through the development of things like the Department of Homeland Security, we are witnessing what I believe is really a fundamental change in the relationships between the three levels of government. And I would in fact argue that over the course of this nation's history, there has been little that has required the collaboration, the cooperation to the degree, among the three levels of government, to the degree that the issue of the security of this nation presents. When you add to that the fact that most of the services that are delivered to the public, most of the services on which the public depends for its daily security, its safety, its comfort, are delivered at the local level, and very few of those services are directly provided by either state or federal government. We have the three levels of government all looking at this problem from at least slightly different perspectives. And so bringing them together in some sort of national effort, not a federal or a state or a local effort, but some national effort to advance the collaboration, the ability to cooperate once we are faced with a crisis, has been one of the greater challenges of the last now 6.5 years. When I talk about the services that are delivered, the reality of most of emergency response in this nation is that it is delivered by local government. It is then supported by the states, and it is supported by the federal government, oftentimes by way of dollars. The federal support typically comes in the form of dollars that will support a response. In fact, many times the response that is, or the contributions to a response that is provided by the federal government may be in the form of taskings to various elements that come in support of local government, but oftentimes those are still representative of other elements of local government from other geographic locations, other geographic regions in the country that are simply moved in to augment an initial local response. So we are dealing with a lot of change, a lot of differences in perspective, and a lot of challenges that really relate to, I think, the relationships that are so important to being successful in a crisis. Let me go a little bit further and describe my view of, and I'll pick up on a little bit of what both Lon and Arn spoke about, and that is that on a daily basis, we all typically operate within the silos or stovepipes that define our organizational responsibilities. In Arlington County, as an example, when the people and the citizens of Arlington call for an emergency service, if they call because a family member is having a heart attack or because they smell smoke on the second floor bathroom of their home, and my organization responds, the people who request that service, the people who are in that acute need of that service, really at that moment don't care whether or not I get along with the police chief in Arlington County. They really don't care if I understand how the local public health system operates. But when we are facing a crisis, the likes of which we did during 9/11 or in 2003 when we faced a hurricane that hit the east coast of the United States and significantly affected our region of Virginia, those same people care about nothing else but that we will cooperate. And so we have to transition from a mode of operation on a daily basis that really is focused on performance metrics, managerial imperatives that define our success. We have to transition out of those things that we are focused on a daily basis and very quickly, very rapidly transition into the ability to collaborate, if not integrate our capabilities so that those same citizens are served better. And here's the reason for that imperative. Arn and his colleague Dutch Leonard have done a lot of work around the idea of what is different in a crisis is the novelty with which we are faced. The kinds of things that no matter how well we planned, no matter how well we prepared for a crisis, certain things will strike us, certain things will challenge us that we either did not plan for, did not create a resource for, or did not figure out a way to respond effectively. And it is during those moments that it is important that we be able to rely on trusted relationships that were developed in advance of that crisis and be able to look at colleagues that wear a different uniform or have a different profession and trust in them to provide their expertise, provide their support, carry out their capabilities in service to those that are most in need, really in an environment in which they are focused not on their own success, their own, whatever it is that they would define as their success, but really look at those that they are assisting in a unified manner to serve those citizens most in need. Now, I use that word unified with great intentionality. The National Incident Management System, which, as Arn spoke about, is a leap from a system that was created in this country about 30 or 35 years ago, the Incident Command System, and has been used in the American Fire Service for most of that amount of time, is new to a lot of the people that we now ask to be partners in that unified sense, that we ask to come together and collaborate during a crisis response. And for many of these folks, and Arn spoke about a lot of these folks that wear uniforms like police, law enforcement officials, certainly the new first responders that we find out in our communities today that work in the public health system. But really, our first response community during a crisis is broadened to be virtually all of government. On 9/11, many of the folks in Arlington County, in fact, many of the folks in the Washington metropolitan area, watched the initial stages of that response and did not think about what their particular role in it was as government workers. They thought more about what their own responsibilities were to very reasonable alternatives of family, where are my children, how do I ensure that I am protecting them. And one of the messages that we have tried to instill, certainly in Arlington County, is that every member of government is a responder when we face a crisis. In Arlington County, as the 9/11 response evolved, we had very non-traditional people in the government participating in the response. Our parks and recreation folks played a very critical role in the response to 9/11. Certainly, as I say, our public health folks, our public works folks, as Arn mentioned. It really is all of government that needs to come together. And what the challenge that we face in bringing all of those folks into the response system is, what is the management framework under which they are going to operate? And that management framework is, in fact, the National Incident Management System or the Incident Command System. And teaching them to use really what amount to very similar principles with which their organizations function every day. We are simply using those in an emergency context. Literally, those principles of a central authority, there is a central command decision-making authority, yet we still use the principle of span of control to break down the incident into manageable pieces, and in fact rely on people to manage elements of the response based on their technical expertise, not necessarily their role in the hierarchy. On 9/11, I was not the fire chief in Arlington County. I was the assistant fire chief. But the fire chief had the very instinctive observation that it was myself and my operational commanders that had the most experience with managing large-scale incidents, with taking that incident command system that we used on a daily basis and evolving it into a larger-scale response. And he knew that his role could be better served in operating at a higher level to ensure that various other elements of the larger system were connected and operating in a synchronized way. So our challenge is among the three levels of government to bring them together and work collaboratively during a crisis, and then horizontally acknowledge that there are elements of government, the private sector, especially as we relate to the private healthcare community, that need to integrate their capabilities